everyone. We're live here at ASAPS 2019, and the IM3 booth is proud to welcome Dr. Elizabeth Hall-Findlay. For those of you that don't know, she goes by Betsy. Hi, Betsy.
Hi, Sam.
We have a conversation topic today that is new and in the news and quite important. So something a little bit different than we normally do, a little bit more interview style, where we're talking a little bit about a new topic, something that has been in both the media and has been covered not only in North America but worldwide. So we're going to talk a little bit about ALCL and some of the issues and controversies surrounding that today. But before we get into it, let's start with a little bit of background. Why don't you tell the people out there that don't know you and don't know who you are, which you should, but for those of you that don't, why don't you give us a little bit of background and tell us where you're coming from?
So my name's Elizabeth Hall-Findlay. I'm a plastic surgeon in Banff, Alberta, Canada. Yeah, that's me.
That's you.
That's me.
How long have you been doing plastic surgery,
That's
Betsy?
not fair.
Okay,
Over 30 years.
Over 30 years. Okay, we'll stick with that. And again, for those of you that don't know, Dr. Hall-Findlay is very well recognized and very well known in this space, especially in plastic surgery. She's contributed in a lot of scientific journals, a lot of really considered a medical expert, written some books on breast surgery, whether it's revision, lift, augmentation, all those kinds of things, right?
Correct.
Excellent. So when I say ALCL, some of us out there are not going to know what that stands for and what we're talking about. So why don't we start off with basically getting the foundation of the 60-second pitch? What is it, if someone hears about it, what is it that we're talking about today?
ALCL is a lymphoma that's not a breast cancer, but it is a cancer. It's a lymphoma in the capsule around certain breast implants. So it stands for Anaplastic Large Cell Lymphoma. It sounds kind of scary, except nowadays we do believe that in almost all, if not all cases, it's now completely treatable with removal of the implants. They're usually aggressive textured implants, removal of the capsule, and replacement with smooth implants.
Basically, ALCL has to do with a cancer that is now associated. Is it only associated with breast implants?
No, I think there's been a couple of reports of dental implants, but it seems to be associated almost always with aggressively textured implants, so that there's no single case that we're aware of right now where only a smooth implant was used.
I guess the bigger question is why for the last several months, 2018 into 2019, why are we hearing so much about it? How can I open up CNN and the Washington Post and different world outlets on news, and why am I starting to hear about this? Is it either that prevalent, or is it a hot topic, or why is it that people are starting to hear about a problem with breast implants?
Well, it appears to be a new disease, and the thing about it is we're only starting to recognize that it's a disease associated with breast implants. It is rare. There's no question it's rare. Like, breast cancer occurs in 1 in 7 to 10 women. This is occurring, we think, in probably 1 in 3,000, maybe 5,000 women. We're still not sure. So it's a new disease. So the World Health Organization has come out and called it a new disease. But it does seem to me, now that we understand it better, it's not chemotherapy, radiation, it's just surgery to cure it.
So considering that, knowing that it's something new, it's something kind of on the forefront, what is the general consensus from surgeons worldwide? What is the thought process around this? Because obviously, if there is a risk, then you have to do something to mediate that, right? Or in some other way take precautions, or what is the general consensus that's out there right now?
I think for most plastic surgeons, everything we do has trade-offs. So you can go above or below the muscle. There's advantages above, advantages below. So there are plastic surgeons that feel that there are a lot of still advantages to the aggressive textured implants. I don't agree with that. My personal feeling is, if we know that it is associated with a cancer, even if it seems to be a treatable cancer, I'm not going to use it.
Okay, and are you a lone wolf when it comes to that, or is that something that is being held by other physicians, other surgeons, other institutions?
I think it can happen. It's both ways. There are a lot of plastic surgeons who believe that we should not use aggressive textured implants. And over in Europe, for example, France has banned their use. Canada has put on it's not a ban, I'm not sure quite what it's called, whereas the FDA has come out and said, no, we're going to still allow those implants to be marketed and used. But there are, like anything else, there's a group of us who believe that they shouldn't be on the market, that we shouldn't be using them. There's a group that say, well, if you're more likely to get hit by a car and killed by a car than this causing a problem in your life. My personal feeling is if we know that it's associated, that aggressive textured implant, my feeling is that trade-off of the potential advantages of it are not worth it.
Interesting. So you kind of sticking with that, and I'm presuming Canada's kind of following suit with what it is that you're looking at and your point of view on that? Or are you being more aggressive for your own practice, or where does that fall in line? And I guess the bigger question is, why is France and Canada doing something? Why is Australia considering something? And why is the FDA and the US doing something different? Why are they not agreeing all at the same time? I guess this is the controversy, right? This is the reason?
I don't think it's that they don't necessarily agree. They all agree that it's an issue. Is it an issue that is enough that you should ban the implants? In Canada, we had those aggressive textured implants for a lot longer than the US did. We, as a group of plastic surgeons, started moving away from them more because there were some other issues associated with them. There's fluid buildup, some other things that we sort of thought that those trade-offs were not worth it, and we went back mainly to smooth. Now, some of the breast reconstruction patients, those surgeons still believe that those implants may have an advantage, but Canada doesn't use many of those implants at all. The U.S. tends to use them more. The FDA is saying, yes, we're concerned, but we want to study it a little bit more, knowing that this is not it's a cancer, but it seems to be a very treatable cancer. So they're taking a bit of a different tack. I don't think it's either right or wrong. It's controversial.
Okay. So knowing that it's controversial, but in your practice in beautiful Banff, Canada, and people that you're seeing, how are you addressing it? How is it actually coming to fruition? Are there people asking you questions? And if so, how are you responding? What is it that you're saying to them?
Well, I used about 150 of these aggressive textured implants, stopped using them back in 2006, 2007. 2 years ago, I wrote a letter to all of my patients who had those implants. So those patients have already know that I've been in touch with them. Some of them came in after the letter in a bit of a panic, and we went through it all with them. I think, and some of the patients are coming in that have the smooth implants that are worried because they didn't keep the records I gave them as to what kind of implants they had. And so they're coming. We have the records. We don't throw any of them away. And so patients will come and they want some reassurance that they don't have those particular kind of implants.
Okay. So from a patient perspective, that's already handled. But I guess maybe from a marketing perspective, and look, you have a name in both the industry and with patients alike. You've been doing this a long time, and a lot of people come to you. But what do you have to do from a marketing perspective, I guess, to stay in front of this? Does this really, at the end of the day, just boil down to education and making sure that the patients know everything? And how do you do that?
I talk to them, explain it to them. I can give them resources if they want to. I think they just want to know that I will be there for them if they have a problem. And if you're going to talk about what am I going to be doing differently in my practice, whether it's, I guess you could call it marketing because that's your business, but what I'm going to be doing is doing ultrasounds and offering ultrasounds for patients, no charge. We're not doing a diagnostic ultrasound. We're not a radiologist. There's no guarantee. It's just a way of looking and seeing, do you have a problem? Do you have a fluid buildup? Do you have an implant rupture? And again, it's just a first step in that diagnosis because I'm not a radiologist. But that's what we're doing.
And have you seen any sort of increase in volume in business of women that are coming to you saying, you know what, I no longer want this implant in me, whether it's a procedure you performed or from someone else? Have you seen it on the rise elsewhere?
You know what we're seeing, and this happened in 1992, we're seeing a lot of patients that think that their implants are toxic or that they have breast implant illness. Because now, in 1992 we didn't have this, and now we have all sorts of internet information and misinformation, and I kind of liken it, we believe the science is pretty clear that implants don't cause disease except for this ALCL, and it's only with the aggressive textured implants, it seems. But with the so-called breast implant illness, it's really frustrating for me because I've had a couple of physicians tell their patients that they're allergic to their implants. Well, that's because physicians are getting their information from the media and not from us. And so that what they really need is to understand that it's a much more complex thing. There are patients who are ill. But you know, if you have a child and your child develops autism, it's impossible for you not to think that it might be related to their measles vaccination. The science is black and white that it's not. I mean, the guy who did that, they found out later he lost his medical license. They found out later he was taking money from the lawyers to do a lawsuit. It's totally wrong. The science was clear. And those of us believe the science is clear on breast implant illness as well. That doesn't mean that patients don't get sick. And those patients need help. They need explanation. And it is just like the anti-vaxxers. How could you not believe that your child had autism because of the measles vaccine, because of what's out there, even though we know that's not true?
So basically what you're saying is sometimes it is in some ways correlative, but not causal, right? Like there's no causation. It just happenstance that, this happens at the same time.
Well, when we went through this in 1992, the Institute of Medicine looked at women with implants. So who gets implants? Young to middle-aged women.
Right.
And what happens to a group of women, men, whatever, as they grow older, a certain number of them are going to get diseases. So they looked at women with implants and matched them to women without implants and found that both groups, the same number of women got diseases, and they got the same kind of diseases, autoimmune diseases being more common in women than in men. So again, it's really hard if you do get sick not to try to find a cause, and patients don't like, I don't know. Okay. So it's very difficult, but the science is very clear that implants are safe. Implants don't cause those kinds of diseases, but it's hard for patients not to think so and want them removed.
All right. Well, kind of my last question, and we've covered a lot now with ALCL. This is slightly different because you talk a lot about education, both of patient and stunningly of other physicians. But I think what a lot of people want to know is I'm not, for the doctors that are watching this all over, I'm not Dr. Hall-Findlay. But how can I set myself apart from the other plastic surgeons? What do you do both internally as a physician and also from a marketing perspective? What do you do to be you, that some sort of gem or nugget that they could take away for themselves?
Well, I think over the years, and I have been in practice for more than 30 years, I think what separated me from other people is that I am honest about what's best for the patient and not what's best for me as a physician, meaning it's not about the money. I want to make sure, of course, I work for value, but I want that to be value for the patients as well as for me. So what makes it different? I'm listening to the patients, and sure, I do have some patients who walk out of the office and slam the door because they don't think I'm listening to them, but I do try to listen to their concerns, but some of them just have their minds made up that they're sick because of the implants. I will take them out, but I don't think it's medically indicated in most cases.
So that wraps it up. That's it from ASAP's 2019 IM3 with Dr. Elizabeth Hall-Findlay talking about ALCL. For everyone that's out there, thank you so much for tuning in.